No.
Hi, it's Dr. Pinto at Vive, Medical Weight Loss and Aesthetics. So there's many reasons why weight loss resolutions don't come true for lots of people. I've made them myself, everyone has. And everyone wants to be healthier and lose weight for the new year, and we're here, we're in a new decade. But the problem is that the way they go about doing it usually doesn't work. And here at Vive, we're here to help you do it. So the number one reason why it doesn't work is people join gyms. They join a gym, they think, I'm gonna exercise and I'm gonna get healthier, I'm gonna lose weight. The reality of it is that most gyms know that the first couple months of the year, they're gonna be really crowded, and then the rest of the year, they're gonna be empty. And they gladly take your donations every month, and they just know that, and the reason why is because the reason why people stop going is because they don't see the weight loss really happen, and they get frustrated, and they give up. Reality is, when you're exercising daily, it's really to be healthy and not to lose weight. In fact, it's one of the worst ways to lose weight alone, and that's proven in many studies. So joining a gym is great, but just joining a gym thinking it's going to help you get to your goal of losing weight, it's probably not going to happen. The second thing is people choose crazy crash diets that are not really based on anything scientific. There's nothing that's proven that it works. So they do these diets, or they do a diet that does work, like let's say, for example, a keto diet or a paleo diet. It's a great diet, but it's really hard to sustain if you don't really know what you're doing. And it's one of those diets where it's an all or nothing thing. If you're only doing it partly, it's not really going to work long term. The third reason is that people just don't have any way of holding themselves accountable for the long term. We know that weight loss is tough, and at Vive, that's how we help patients see early, quick weight loss. And we have lots of ways we do that, but when you see some results, it motivates you to continue to lose more. How do we do it? What do we do? So if you've already been to our office, you know what it's all about. But if you're new or you want to try us, this is what basically happens. When you come in for your consultation, we learn a little bit about you medically and your weight history. We find out what made you overweight. Was it just a bad lifestyle choice? Was it, is it genetics? Is it other medical conditions? Is it just your environment? Is it just years of yo-yo dieting that's kind of messed up your metabolism, which is what a lot of patients think. The reality of it is not much messes up your metabolism. It's just lifestyle and it's just choices. So we help you identify those mistakes and correct those. We also can help with hunger and cravings. That's a big part of this. Most people start the day trying to eat well, and they eat a good breakfast and lunch is okay, and then they start to get hungry 2, 3 o'clock and they start snacking on things that aren't so good. Dinner comes, and then after dinner, eating and snacking and ice cream and whatever, and everything falls apart, and then we say, all right, let's start again next week. So what we're going to do is we're going to help you be less hungry. We're going to help you have less cravings, and we do that different ways, but one easy way to do it, in a very safe way and a very effective way, is using FDA-approved medications. There's a few on the market that are relatively new, and there's some really old medications, but knowing how to use them properly, which we know how to use them here, is the key. There are lots of doctors out there who are happy to write your prescription or sell you some pills. Unfortunately, maybe your best interest isn't what's in mind for them, and they're not really approaching it the way it should be done. So we want to use the lowest effective dose of different medications depending on the patient's needs to achieve these results. And not one medicine works for everybody, but we certainly can help usually most of our patients find one that works for them. So sustainability and accountability is something we provide. We show you weight loss results, and we get you the results in a manner that is safe and effective. Really what we want to do is not only help you lose weight, is we want you to learn how to keep the weight off, and that's even harder. So our practice is all about getting results and then teaching lifestyle changes to maintain those results for the rest of your life. Hope to see you soon. Thank you.